Hey everyone! If you're a nurse or just someone interested in health, this video is for you. Today we're talking about osteoarthritis, the most common type of arthritis that affects millions worldwide. It's a condition that hits close to home for a lot of us, impacting our ability to move freely and live life to the fullest. But don't worry, I'm here to break it down in a way that's easy to understand, so you can take charge of your joint health. So, what exactly is osteoarthritis? Imagine the cartilage in your joints, like the smooth, slippery coating that lets your bones glide over each other. Now, imagine that coating wearing down, kind of like the tread on your favorite sneakers. That's what happens in osteoarthritis, also known as OA. As the cartilage breaks down, the bones start rubbing together, causing pain, stiffness, and that achy feeling you might experience. It usually affects joints that we use a lot, like our knees, hips, hands, and spine. And guys, this isn't just your grandparents' problem. It can affect people of all ages, especially if you've had a previous injury or put a lot of stress on your joints. Now let's talk about risk factors. Who's more likely to experience osteoarthritis? Well, age is a big one. As we get older, our joints naturally experience some wear and tear. But it's not just about age. Ladies, unfortunately, we're at a higher risk, and researchers are still trying to figure out exactly why. Carrying extra weight also puts more stress on our joints, increasing the risk. And if you've ever had a joint injury, that can make you more susceptible to OA down the road. Genetics can also play a role, so if it runs in your family, it's something to be mindful of. Lastly, if your job or favorite sport involves a lot of repetitive movements, that can also put you at a higher risk. The good news is, there's a lot we can do to prevent osteoarthritis or slow down its progression. First and foremost, maintain a healthy weight. Every pound you lose takes pressure off your joints, especially those hard-working knees and hips. Regular exercise is also key. It strengthens the muscles that support your joints, kind of like giving them a team of bodyguards. And when you do exercise, make sure you're using proper techniques to avoid injuries. Listen to your body and don't overdo it, especially if you're just starting out. Lastly, fuel your body with an anti-inflammatory diet. Think colorful fruits and veggies packed with antioxidants and healthy fats like those found in oily fish and nuts. Chapter 4. Now let's talk about things that can make osteoarthritis symptoms worse. Overusing your joints is a big no-no. Repetitive movements, especially without proper rest, can aggravate the condition. But here's the thing, inactivity is just as bad. It might seem counterintuitive, but moving your joints regularly actually helps keep them lubricated and flexible. Poor posture can also put extra strain on your joints, so be mindful of how you're sitting and standing. And for some people, cold weather can make those joints feel stiff and achy. Chapter 5. So, how do you know if you have osteoarthritis? Well, if you're experiencing persistent joint pain, stiffness, or swelling, it's definitely time to see your doctor. They'll ask about your symptoms, examine your joints, and check your range of motion. To get a clearer picture, they might order an X-ray, which can show cartilage loss and any bone changes. In some cases, they might recommend an MRI or blood tests to rule out other conditions. Remember, early diagnosis is key to getting the right treatment and managing your symptoms effectively. Chapter 6. Now for the good stuff, treatment. The goal is to manage pain, improve mobility, and keep you doing the things you love. Let's start with non-medical options. Physical therapy is like gold for osteoarthritis. A good therapist will teach you exercises to strengthen muscles around the affected joint and improve flexibility. Remember how we talked about weight management? It's crucial for taking pressure off your joints. And don't underestimate the power of low-impact exercises like swimming, walking, or cycling. They're gentle on your joints while keeping you active. Braces and supports can also provide stability and reduce stress on the joint. And for those achy days, heat or cold therapy can work wonders in relieving pain and stiffness. Now, on the medical side, your doctor might recommend pain relievers like acetaminophen or NSAIDs like ibuprofen. In some cases, steroid injections can help reduce inflammation and provide temporary relief. Hyaluronic acid injections are another option, acting like a lubricant for the joint. And for severe cases where other treatments haven't provided relief, surgery such as joint replacement might be considered. Osteoarthritis can be managed with the right lifestyle choices and treatments. Remember, you're not alone in this journey. Millions of people are living full and active lives with osteoarthritis. If you found this video helpful, give it a like, share it with a friend, and subscribe for more health tips. Let me know in the comments if you have questions or topics you want to learn more about.